is Morgan Jivens, and we will be talking about the sacrum, especially in regards to postpartum women. So this is Aaron today, and he's going to be my patient. So when we talk about the sacrum, in case you don't know what it looks like, it is this bone here in the middle. And when we talk about it, we refer to it at the top is considered the base, and the bottom is considered the apex. So the sacrum moves in time with our breath. So if this is my sacrum here, then when I breathe in, it is going to move back or posterior, and when I breathe out, it moves forward or into flexion. So back, we're thinking extension, and forward, we're thinking flexion. So when we think about childbirth and the baby's head coming through the birth canal, what happens is at first the sacrum will extend to let the baby's head descend into the pelvis. After that, the sacrum will flex to let the baby's head down to come out of the vaginal canal. Many times in childbirth, the muscles and ligaments that are attached to the sacrum will get stretched and pulled, and the sacrum will be stuck in this flexed position. And this can be very painful and uncomfortable for postpartum moms. So this bilateral flexion is what we're going to talk about treating today. So the first thing that we think of when treating the sacrum and with testing for it is we would like to have our patient sit up like they're sitting on the chair. So if Aaron, if you could go ahead and sit up and face the camera there. And normally we would like to have our patient's feet on the floor. At this time we're unable to do that, but it's okay. And what we want to do is take, and you'll find little bony protrusions in the back here, referred to as the PSIS. And you want to put your hands on those, and you want your patient to bend over slowly. Good. And they can sit back up. And what you're looking for here is to feel which PSIS moves first. In the case of a bilateral flexion, it will give you what we call a false negative, and that they will seem like they move at the same time, but the patient will still have some dysfunction there. So next, we are actually going to have Aaron lay down on his stomach. And actually, would you scoot back towards me just a little bit? Perfect. And so now what we're doing is looking at our sacrum here, and you'd be able to feel your sacrum right back here. And what you're feeling for is a little depression on the top of your sacrum at the base, and we call that the sacral sulcus. And so we name the sacral sulcus in terms of deep or shallow. So if the sacrum is extended, then we will feel the sacral sulcus as more prominent. If it is flexed, they will be farther down, and we'll feel like we have to press a little deeper to press in there and feel them. So we would name these to be deep when we're treating a bilateral flexion of the sacrum. And then we move down here, and what we'll feel is a little drop off. And what we're looking for are called the inferior lateral angles of the sacrum near the sacral apex. And these are almost like the corners of the sacrum. And we name them just like we name the sacral sulcus. So if they are closer and they feel they're shallower to our fingers, we're going to name them as shallow or posterior. If they are deeper, then we will name them deep or anterior. So in terms of diagnosing a bilateral flexion of the sacrum, we would name the sacral sulci deep and the inferior lateral angles shallow, because we can feel them near the surface. So we're going to treat this with muscle energy. The first thing we want to do is place the heel of our right hand over the apex of the sacrum. This is where we're going to put the majority of our pressure, because with a flexed sacrum, this is the more shallow part. When he breathes in, what we are going to do is we are going to move along with the sacrum as it goes into extension. When he goes to breathe out, we are going to hold it there so it cannot go back into flexion. So I'm going to place my hand here at the apex, and then I'm going to take my left hand and place the heel over. And then I'm going to ask Aaron here to take a deep breath for me. We're going to follow the apex down, and then we're going to hold it there as he breathes out. We're going to follow it down as he breathes in again, and hold it there as he breathes out. And you just continue to do this until you feel a release and the sacrum moves a little bit easier. And so after we do a treatment, we always want to go back and double check. So we would go back up here to the sacral sulci, and we would check to make sure that they are more posterior or shallow than they were before. And then we would check and go back down to the inferior lateral angles and do the same thing and feel that they moved there also. So today we learned how to treat a bilateral flexion of the sacrum, which is very common after childbirth, and that's something that's just very useful for women when they go home and sometimes can be in pain. Thank you for coming to spend time with me, and I hope you enjoyed this lesson.